Hi, it's Lisa, and in this video I would like to answer to some of you in the last comment of my last video. You were asking for some tutorial guidance for oral motor exercises for babies and involving babies with cerebral palsy or Down syndrome or other different conditions, right? So this video is going to go for you. Thank you for watching me again. Before to start, I would like to introduce a concept, typical and atypical development. This is super important. When we are talking about typical development, or in another term, sometimes I will read or hear professionals talking about normal babies. I would like to suggest you to stop using that terminology. We don't talk about normal or abnormal babies, we talk about typical or atypical development. Typical development is those kids, that child who is following the typical development, who is passing through the milestones, who is following the timetable, who is maturing the nerve system accordingly to how the milestone should develop. Now, when we talk about atypical development, it's when we are going to jump to the place, where the child is struggling to develop certain skills or certain milestones. For example, let's say the child should be sitting posture at 6 months old, and your child is not doing that. Plus, we have hypertonia, or we have some babbling issues, we have visual issues or hearing issues, and we have an accumulation of warning signs. Now, if you would like to learn more about typical and atypical development, and in general, if you would like to know more about child development, what should happen at 3 months, what I am expecting at 6 months old of life of my baby or of my patient or of a family member, I did recently a course based on child development, and I'm going to bring the link in the description box, so check it out. Let's jump into today's topic. I prepared some of the material that I normally use in order to work on the pre-linguistics activities. So what are the pre-linguistic activities? Those are the blowing, breathing control, sucking, swallowing, chewing, licking. All of these are super important pre-linguistic skills that exist or should exist in all of us. First, we are going to start with the breathing control. For the breathing control, normally I use whistles, bubbles, blowing instruments, any blowing instruments, musical instrument, okay, balloons, etc. So I would like to share with you what normally I use, okay? So I have a kit where I have some of my whistles or some of the material that normally I use, and yeah, I didn't bring everything, but normal whistle that you can buy in any shop. This will help us to work on the blowing. Sometimes what is happening with this whistle, that some children will be able to blow, but they are going to inflate a lot of the cheeks. In order for us to strengthen all this area, we should be working on these muscles. How we can work on these muscles? Ask your child to blow without inflating the cheeks. Some of you mentioned me that you have children non-verbal that doesn't follow instructions. When I'm referring to ask your child, it's not meaning that you have to say, Lisa, can you please blow with the cheeks, not inflating? No. Basically, we can do it verbally or non-verbally. If your child does not follow verbal instructions, we can, with our fingers, we can press our cheeks, okay, and we can make a small pressure over here. So when the child is going to blow, the cheeks will not inflate. Like this, automatically you are working on stimulating these muscles, because most of the time when we are talking, our cheeks are moving a lot. When we want to say a, e, o, u, all this part, if you try yourself at home, try it now. A, E, I, O, U, you will feel like this part, all this part, it's working. So when we are going to ask the child to blow, it is important that when we are blowing, our cheeks doesn't move. We don't have inflation, okay? Another type of whistles, it's for example, this one we use in pad 1 therapy, and it's very, very useful. And it's funny because it has a sound. So different type of wooden whistle will produce sound, and maybe it can cause interest in the child as well. So just as a suggestion, but otherwise you can work with both of these. Also, you can work with bubbles. Bubbles has different effect, right? For bubbles, you need to actually know how to blow. So this exercise will be the pre-bubble exercise. So we work on the blowing, but often we work in the blowing of the mouth. It is super important to know how to blow from the nose. Many children in my practice do not know how to blow their nose. Actually, it's one of the exercises, main activities of the daily life that I work with. It's super important to know how to use our nose. And most of the time, in most of the therapy, we forget that. So we just use this one. My child knows how to blow, fantastic. But does your child know how to use the nose? This type of whistle, it's like another wooden whistle that we use in pad 1 therapy. We will place the whistle in the nose, and we are going to ask the child to blow. Important things. This is super funny. And normally children loves it. What we are going to do is, obviously we are not going to give them instruction. We are going first, it's super important to show. So the first step, it's always, I will show my client, I will show my child what I want from him, from her. I want him to blow from the nose. If the child is capable to do it, then we can just practice and we move on to something else. If the child is dependent and we as therapists, family, we have to do it, educators, etc., we can place one of our finger and we close the other nostrils, okay? And from the other side, we blow. Sometimes what we are going to do, sorry, I will be talking like this, no. Sometimes what we are going to do is we are going to place just here, and we will see if with a normal breathing, the child will do it by himself or herself. If this doesn't happen, it is important to have our mouth closed, nostrils closed, and then produce the sound. Why I like instruments with sound? It's because you can hear it. If you don't hear the sound of this whistle, it means that the child is not blowing. Sucking is the next step that appears in our pre-linguistic skills. For sucking, normally we are going to use something that is called the dummy or the bottles, no, when they are drinking water, etc. Let's divide the topic. Children who already know how to suck or who are able to have the skill of sucking with the dummy. So if I have a dummy, and I'm doing this movement and I'm asking the child, I give him the dummy, and the child is doing this movement, and the child actually is doing the sucking properly, it means that the sucking, it's there, it's integrated, and it's working. Children who do not suck, children who do not drink from a bottle, children who doesn't hold the bottle, children completely dependent. So, the same. Exactly the same. The adaptation is the same. Why? Because the skill is the same. What we are going to do, it's basically the same. We are going to introduce the dummy. If the child uses the mouth open, we are going to close the mouth as much as we can. We are going to introduce the dummy. And what we are going to do is we are going to stimulate a little bit, gently, slowly, the cheeks. That's mean what we want is we don't want the child to know how to suck properly in 5 minutes. So the most important is first acceptance of the dummy. Second, very important, to let us to manipulate and to work on the cheeks. And the third, very, very important, it's actually do the movement. That's mean we put the dummy, and we stimulate the cheeks. In order for stimulation the cheeks, you can use this exercise that I did in my video, in my prior video, these exercises, okay? And then use the dummy. If you would like to work completely, I will use this exercise, I will use the whistles, mouth, nose, and then I will use the dummy. That's all for today. Between the breathing control and the sucking, you should be more than equipped to work on these muscles and to reinforce your oral motor skills of your baby or your child. Thank you for watching. Don't forget to subscribe, share the videos, write the comments, and give me your feedback. Thank you and see you in my next video.